Warm Ayurveda greetings. Good morning from UK because it's morning time here. So welcome to everybody who is listening or who will listen afterwards. My name is Dr. Ashish, as many of you know. And today I just want to highlight, or I want to talk about, how do we serve our patients? How do we support the patients who walk through our door? How do we support people who are connected with us? How do we support patients, clients, customers who are interested in what I do or interested in natural medicine? How do I support them? And how do I support with the rest of my team? So that's what I would like to mention, the number of things that we do here at Ayurveda. So one thing I always have, or the main thing that I have at the forefront of my mind, always when I am consulting patients, when I'm seeing patients, or when anybody asks any query or question regarding their health, is what is the best way forward for this patient? Not that what I am interested in, not that I am doing Ayurveda, I only want to help this patient with Ayurveda. I am a herbalist, I only want to help this patient with herbal medicine, or that I use NLP or yoga, I only want to help this patient with just these things. I want to help patients with what is best for them. So the patient's interest is at the core of everything. So it's important I think for all of us to understand, people who do healthcare, is that sometimes we get so lost, and I see it with many practitioners, that we want to help patients, but we have our own agendas. We only want to use a certain system, or we only want to use a certain medication, or we only want to use Ayurveda or herbs or whatever that is. But for me, it's at the end of the day, it's the betterment of the patient. If patient is not getting better from whatever I'm advising or telling them, then it's really of no use. So how do we support patients who are connected? How do we support them? What do we do here? What do we do here at Ayurveda? So as you know, I do Ayurvedic medicine, which is one part of my learning. That's my main base on which my knowledge, my expertise, my skills are based on. Ayurvedic medicine. And I know that many people can't even pronounce it. So I'm on agenda to ask everybody to pronounce. It's Ayurveda. So it's the science of life. It's the oldest system of healthcare that we have in the world. And very effective scientific system that we have. And we have empirical evidence of thousands of years that Ayurveda has been effective. So that's one of the main thing that I base my skills on, Ayurvedic medicine. I'm also a Western herbalist as well, so I'm trained in herbal medicine in UK and Europe. So I help patients, I advise them according to what is needed, what herbs are needed. So I use that as part of my skill set as well. How else we serve our patients? I am a trained NLP practitioner and a hypnosis practitioner as well. So I use NLP as part of a tool to help me in connecting better, in understanding my patients better, in understanding where they're coming from. I also teach yoga. I also use yoga as part of my consultations, as part of the tools that I give my patients. So yoga is also there. I also give lifestyle advice, dietary advice, and this dietary advice is Ayurvedic as well as modern. Nutritional advice is also part of it. And I use meditation also, which is also part of the things that patient walk away with, something that they can use always. They don't have to keep coming back. Once they've learnt it, they can then use it themselves. So there are a number of ways in which a patient is supported when they come through our door, when they come and connect, when they want to use something. Either it's for fertility, either it's for rejuvenation, either it's for digestive issues or for women's issues. But as you know, that my key areas are fertility. I support number of couples going through either IVF or natural conception. And I also just launched rejuvenation therapy as well, so rejuvenation in a natural way. So this is to support couples, this is to support people in their journey in the best possible way that is needed for them, not what I think is the best. All therapies have their place. All therapies can work in collaboration with each other. We just need that will to make it work. So I work closely with IVF experts as well, because I support couples going through IVF journey, and it works very well together if we know what we are doing. I work with doctors, GPs as well, with patients who are on medications. We give them medication so that they can work in collaboration for the best interest of the patient. I think that's the key that we have. Sometimes we lose that focus because we think, okay, no, I'm so passionate about Ayurveda. I just want my patients to only use Ayurveda and not use any Calpol, not take any medication. But that's not what I am there for. I am a tool for them to get better. And I want patients to get better. I want their health to get better. I want them to be the healthiest possible. And that is only possible in whatever way I can support them. Not the only way that I think is the best. So it's Ayurveda, it's herbs, it's nutrition, it's yoga, it's meditation, it's NLP, it's hypnosis, it's EFT, which is emotional freedom technique that I learned many years ago. It's massages, it's therapies. All of that is part of my work. And as I said, I work closely with consultants and doctors as well. And I like the idea of integration. I like the idea of 2 or 3 therapies working together for the betterment of the patient. So all those patients all those people who probably don't know fully enough what we offer, they may get an insight today that how we can help them. And also some of those patients or people who connect, and they have this apprehension that, okay, how is this going to work, because I take so many other medications, or I take allopathic medications, how is it going to work? So again, this is for your betterment. This is for the betterment of the patient. This is not for my betterment. This is not what I think is the best system in the world. I know Ayurveda is the best system in the world, but still, when patient says, I want to take herbs, or I only want to use yoga, or I only want to use meditation, then I'm here to facilitate that. We are here as me and my team to facilitate that so that you can get better. Eventually, that should be the agenda of us as complementary practitioners, us as natural therapy practitioners, to make sure that patient feels comfortable in what they're using, they feel happy and connected. Because otherwise, if they don't have the faith in practitioner, if they don't trust me that I'm going to do the best for them, then medicine is not really going to work as well. So yes, I just also maybe want to encourage other practitioners. I know many of us who get sometimes little lost in the sense that we think, okay, this is the best thing and I only want patient to use that. I would encourage you to really just keep this, right here at the forefront, that patients' health, the way they want to choose to get healthy. So if I have all these things in my basket to offer them, and if they're happy to take that, then that's, they can choose to do that. I'm of course here to advise, for them to, okay, if this is going to work better than the other therapy, we can advise them. But eventually, it's their choice, and we are here to facilitate that. And I'm here to facilitate healing journey for my patients with all the things that I do, and to help them and to support them and to make sure that they connect with it. If they do not have that connect, either with me as a practitioner or with the therapy that they're using, if there is any doubt, it's not going to work as well, because we know that faith is the biggest healer, and that's the faith in the medicine, that's the faith in the doctor, that's the faith in me for my patients is what is going to heal them. So yes, anybody who know a little bit what I do, or anybody who would like to know a little bit more what I do, maybe you can pick up from this the kind of things that we offer here. So there is Ayurvedic medicine, and we offer all Ayurvedic therapies, Panchkarma, and all the treatments which are body treatments as well as internal herbs as well. I offer Western herbal medicine also as part of my clinical work. There is NLP, which is neuro-linguistic programming. I offer yoga as well. I practice dynamic yoga, although now it's my own style of yoga, which I recommend. It's very gentle to go with what patient needs. And I also use meditation, visualization as part of the whole set. So it's you, the patient, who is the most important, not the practitioner. Practitioner is only a tool to help you to get your health better. So do connect, do ask any questions if you have regarding Ayurvedic medicine or regarding your health, and let me know how I can be the best to serve you. How can I help you? Thank you.